All right, so move on to our next speaker, Dr. Maike Hofmann. You can go ahead and start sharing your screen, Maike. She's trained in molecular medicine with a focus in immunology and virology. She's interested in translational questions concerning the cytotoxic cellular immune response in viral infections and cancer. Her experimental experience covers analysis of T cells and NK cells in mouse models, as well as in patient samples by state-of-the-art immunological assays and cutting-edge single-cell technologies. A main focus of her work in the last years relate to mechanisms underlying the T cell and NK cell dysfunction in the context of chronic viral hepatitis caused by hepatitis B and C viruses, and in liver cancer with the aim to provide rationales for the identification of biomarkers and potential immunotherapeutic approaches that can also be applied to other chronic diseases. Currently, she is the group leader and spokesperson of the research unit in the Department of Medicine, University Medical Center, Freiburg, Germany, and she's going to be talking to us about the CD8 T cell memory in chronic viral hepatitis.
So thank you for this kind introduction. My name is Maike Hofmann, and in the next few minutes, I will give you an overview about the T cell memory in the context of chronic infection. I mean, we've heard previously in the context of vaccination and after acute infection, and now we will switch gears to chronic infection. So, but first, just to get into the topic. So viral hepatitis is a major global health burden with an estimate of about 325 million people affected by the major causes of viral hepatitis, namely infection with hepatitis B and C viruses. And infection with hepatitis B or C virus can either result in a self-limiting infection, or it can progress to a chronic infection that can then progress to fibrosis or liver cirrhosis and even liver cancer. And so hepatitis or viral hepatitis is a classical model of virus-induced immunopathology. And important effector cells in determining the outcome of the hepatitis virus infections are CD8 T cells. And these cells are also important for the pathogenesis. So it's kind of a double-edged sword. And for this, viral hepatitis is also a good model to study CD8 T cell immunity in humans. But now, just as a more general introduction. So what do we know in general about CD8 T cell responses? So in the context of an acute infection, we have an expansion of the T cells until the virus is cleared. Then the T cells contract and a polyfunctional, long-lasting, self-renewing T cell memory is established. However, in chronic infection, virus persists and the T cells are negatively regulated. And this is commonly termed T cell exhaustion. But what is T cell exhaustion? T cell exhaustion is kind of a functional adaptation to persisting antigen recognition or to chronic infection. And it counteracts immunopathology, but it also maintains the T cell response in this context of persisting antigen presentation and recognition by the T cells. And a good model really to study this T cell exhaustion, or where in the past a lot of work has been done in the context of human viral infection, is hepatitis C virus infection. So what do we know about T cell exhaustion in the context of chronic hepatitis C virus infection? So the group of Georg Lauer could show that early at the beginning or early during the acute phase, HCV-specific CD8 T cells differ from patients that finally resolve the infection compared to patients that become chronic. And this really resembles the insights that we've gained from mouse models like chronic LCMV infection, that we have kind of a bifurcation of the differentiation path of CD8 T cells in acute resolving and in chronic infections. But how do these exhausted T cells in the context of HCV look like? They are functionally adapted or impaired, so they have like reduced cytokine production and a reduced capacity to proliferate. They express inhibitory receptors, sometimes also called exhaustion markers. They have an altered metabolism and an impaired T cell homeostasis. They have a distinct transcriptional profile, just two dominant markers. They express high EOMAS and low TBET. And an important factor regulating this program is TOX. And TOX is not only an important regulator in exhausted T cells in murine models, but we could also show that this is an important molecule in the human situation, as here shown for chronic HCV infection. But exhausted HCV-specific CD8 T cells are not homogeneous. They rather consist of heterogeneous subpopulations. And here you can see in red HCV-specific CD8 T cells. In gray, you see just the bulk CD8 T cells for comparison. But if we have a look at these HCV-specific CD8 T cells depicted in red and just analyze for two markers, CD127, so the IL-7 receptor, and PD-1, like the inhibitor receptor, we can appreciate that there are several populations. And in particular, we can identify cells that express CD127 with a memory-like phenotype, but also cells that lack CD127 that have a more terminally exhausted phenotype. But there are not only differences in the phenotype, these are also assigned to different functional capacities. And so, for example, the memory-like phenotype cells, they are clearly associated with the expansion capacity of the HCV-specific CD8 T cells in vitro. So just by analyzing two markers, we can already define different subpopulations of these exhausted HCV-specific CD8 T cells. And to dig into this a little bit deeper and in a more unbiased way, we performed single-cell RNA sequencing of HCV-specific CD8 T cells obtained during the chronic phase of HCV infection. And by doing so, we could observe three clusters. Again, one with memory-like characteristics, one with the terminally exhausted characteristics, and in addition, an intermediate stage population. And if we then perform pseudotime analysis, then we can see that the memory-like cells and the terminally exhausted cells are in a progenitor-progeny relationship via this intermediate stage. But what happened now to these cells after cure of chronic infection? Do we have a T cell memory? Do we have antigen-independent survival of these cells? Because it was assumed that exhausted T cells get kind of addicted to antigen. Are the cells potentially be able to perform a recall response? And do these cells recover from a functional perspective? And these questions became really clinically relevant by the approval of the so-called DAAs, standing for direct acting antivirals, that lead to HCV cure in over 95% of treated cases. So in terms of the T cell response, what we did is that we longitudinally followed the HCV-specific CD8 T cells, again depicted in red, during the chronic phase of the infection and also after cure with this DAA. So in the same patients, we had this longitudinal analysis. And what you can directly appreciate is that the phenotype of these HCV-specific CD8 T cells changes, and we have a predominance of cells that express CD127 after HCV cure. And the group of Georg Lauer even did a more comprehensive analysis of the phenotypic markers. And here depicted in red, the cells before DA8 treatment, so in the chronic phase, and in blue after HCV cure. And you can see that the activation markers are reduced after cure, but memory markers appear or increase after HCV cure. So after HCV cure, we see marked phenotypic changes of these exhausted CD8 T cells, and we have kind of a predominance of the CD127 memory-like phenotype cells. But can these cells now mount kind of a recall expansion? And to address these questions, we had the unique chance to follow a patient that had a viral relapse. And here you see the viral titers, and the titers declined until end of therapy. And then 12 weeks after end of therapy, the viral titers were increased again. And when we look at the T cell responses, T cell response in this patient, we saw that after end of therapy, we could detect some HCV-specific CD8 T cells, but these clearly increased in frequencies after virus was back, so in this relapse situation. So showing us that the cells after end of therapy can perform kind of a recall expansion. But are these cells then really functional? Because we know during the chronic phase, they have an altered functionality and impaired functionality. And so what we did, we performed in vitro functionality assays. So we stimulated the cells for 2 weeks and then analyzed the cytokine production and the proliferative capacity. And we could observe that after this 2-week stimulation, we see an increased production of the cytokines and an increased proliferative capacities of the cells after HCV cure. And the group of Georg Lauer, they performed ex vivo functionality assays, so without this 2 weeks of stimulation. And they could find the same for the multifunctionality of the cells as depicted here, a higher multifunctionality after HCV cure. However, the functional capacities of the cells after HCV cure was still diminished compared to conventional HCV-specific CD8 memory T cells after spontaneous resolution. And this was true for the cytokine production, for the proliferative capacity, and also for the multifunctionality. So there is an increase after cure, but it's still not the same as conventional memory T cells. Now, what can be the reason for this? And to address this question, we performed transcriptomic profiling and could realize that the HCV-specific CD8 T cells after cure resemble more the cells during the chronic phase and are clearly distinct from the conventional memory T cells after spontaneous resolution. And this different pattern was also evident on an epigenetic level, as shown by the Nikanin group, where you can clearly find so-called scarred region in the epigenetic landscape. So we have a signature of chronicity that is imprinted in the HCV-specific CD8 T cells after HCV cure. But now, what determines this signature of chronicity? And of course, we are talking about T cells, and their antigen recognition is a key factor. And so we wanted to know whether the antigen recognition kind of determines this scar. And to analyze this, we made use of the phenomenon of viral escape that frequently occurs during chronic HCV infection. And this just means that the HCV-specific CD8 T cells that we analyze that target escaped epitopes, they do not see the antigen anymore. So we have different antigen recognition dynamics of these cells. And if we now compare the transcriptomic pattern of these HCV-specific CD8 T cells targeting escaped epitopes, we see that this pattern lies in between the conventional memory cells and this scarred HCV-specific CD8 T cells that still recognize their antigen. And so we can see that there is an effect of the antigen recognition on this profile. And the same was also seen by the group of Nick Haining on the epigenetic level. So the chronic scar is determined by the dynamics of antigen recognition. But how is now this scar determined on cellular level, and this maintenance of the scar is maintained on a cellular level? To address this question, we again performed longitudinal analysis during the chronic phase and after HCV cure, and did single-cell RNA-seq analysis. And here you can see our results. The red cells are cells obtained during the chronic phase with this 3 subset I've introduced before: the memory-like, the intermediate stage, and the terminally exhausted. And here in gray, you see HCV-specific CD8 T cells obtained after HCV cure. And you can clearly see this overlay between the HCV-specific CD8 T cells after cure with this memory-like subset. And we then compared these cells, so the memory-like subset during the chronic phase and the HCV-specific CD8 T cells after cure, and could hardly find differences. Only 18 differentially expressed genes were present. This clearly indicates that after HCV cure, we lose these terminally exhausted cells, and these memory-like HCV-specific CD8 T cells are maintained. So to sum this up, during the chronic HCV infection, we have a heterogeneous population consisting of memory-like cells and terminally exhausted that are in a progenitor-progeny relationship. And after HCV cure, these memory-like cells, they are maintained, but they are clearly different to conventional memory T cells. So they have an imprinted chronic scar. But is this now a phenomenon that is restricted to chronic HCV infection? And to address this question, we also analyzed HBV-specific CD8 T cells in chronic hepatitis B virus infection. And also for HBV-specific CD8 T cells, tox is an important marker or an important factor that is linked to the dysfunction of these cells. And if we stain for the expression of tox during the chronic phase and after spontaneous resolution of a chronic HBV infection, we see that this high expression is still maintained. This clearly indicates that we also have a molecular scar in HBV-specific CD8 T cells that remains after the resolution of a chronic HBV infection. So to conclude, we have, after an acute phase, we have a memory response, but we also have this after a chronic infection. But this T cell memory is scarred. It is probably antigen independent. These cells, these memory cells, can mount a recall response. However, they remain functionally adapted. And this was also nicely summarized in an editorial by Hazem Goenheim entitled T cell exhaustion, a memory locked behind scars. And with this, I would like to thank you for your attention, but I also want to acknowledge the people that actually really did the work, especially Katrin, Nina, Matthias, and Dominic. And really important are also the patients and volunteers that donate blood, because without them, we cannot do any of these kind of research. So thank you. And now I'm happy to take questions.
Excellent. Thank you, Maike, for that. It's really interesting to hear the chronic side of the immune response. Are there any questions from the audience?
Yeah, let me ask one question. Yeah, thank you. Great talk, Mike.
Thank you.
Yeah. So now you show that the molecular scar in the memory cell, memory-like cell, after DAA treatment, right? But this molecular scar, it has also some relationship with the duration of chronic infection. It means that if we treat the patient the early after chronic stage, and then less molecular scar, and more longer duration of chronic infection, then more molecular scar. Is there any correlation?
So this is exactly the big question. When is this molecular scar then established? So in our cohort, all of the patients were long-term chronically infected, although there were differences in the actual period of chronic infection, but there we did not see like this marked differences. But I mean, the important question also for advising treatment with the DAA is at which time point is this scar established? And I know that Georg Lauer currently has a cohort to investigate that. We do not, unfortunately, have this cohort of these early treated patients that are required, because you have then really to profile the cells and see whether there is this molecular scar. So from mouse work in the LCMV system, it is known that the decision is made like 12 days after infection in the, but this is LCMV context. And now we have to see when is this establishment in the context of HCV. But I think it's the exact dynamics and time point then depends on the infection. So I think we maybe will see something different for HBV in terms of the kinetics.
Any other questions? Okay. All right. Thanks again, Maike.
Thanks.